Hi, welcome everyone. My name is Mackenzie Jansen. I'd like to introduce you to our session. Recovery takes longer than treatment. We are part of our adolescent program and we are joined with Geoff Eaton today. I'd just like to start off by introducing myself. I'm the clinical nurse specialist for the Adolescent and Young Adult Program here at CancerCare Manitoba. And then joining me is my partner in crime, Ian Scott, who is a social worker and our psychosocial oncology clinician for the AYA program. We have our guest speakers today, Geoff Eaton, who is the founder and executive director of Young Adult Cancer Canada, as well as Dani Roulette, who is a patient with lived experience and a patient partner with our AYA program. So, welcome everyone. Just to kind of get a few things put aside, these are our presenter disclosures. There's not really a whole lot to mitigate any potential biases for today. And just briefly, I'll go over our learning objectives. So basically, we have you here today to just learn about our adolescent and young adult patients who are finishing treatment and just the nuances that happen as we experience recovery. We're also going to hear from um, our patient partner, Dani, about her personal experience. And then we'll have a discussion about what life looks like for us. All right, so I'm going to hand it over to Geoff right now. Welcome, Geoff. And he's going to share with us a little bit about what this experience looks like for our AYAs.
I am really glad to be here. Thanks for the invite to CancerCare Manitoba, and great to be here with Dani and Ian and Mackenzie. I am just going to take you through a little bit of the background on my own story and share with you some really important information about Young Adult Cancer Canada's work and some of the things we've learned through our research and our support of young adults with cancer all across Canada. This is a picture of me taken more than a few years ago. You may be able to tell there was a big mullet underneath that graduation cap. That's me at 22 years of age, finishing business school, making a whole kinds of fun, amazing transitions. Moving out of my parents' house, I'd started my own business in university, and let's just say I was pushing my limits anywhere I could find them, and absolutely loving it. And if you are at that stage of life, or you were, you know it's different. And it is largely driven by I think, the foundational things we're doing with our life at that time. Finishing school, right? Starting careers, and sometimes even starting families. This is the things that we hopefully will build the rest of our life on. 6 months out of university, I was diagnosed with acute myeloid leukemia. A good buddy of mine and a yacker, Steve Webster, used to say, when you're just starting your life, cancer forces you to face the end of your life, and that impacts the rest of your life. And that is deeply wise words from my buddy Steve. And the road of life being very different for young adults, it makes sense that if you get diagnosed with cancer as a young adult, you're going to have some unique challenges facing you. Almost all of us have someone we love who's been diagnosed with cancer. It could be as a really young kid at 5 or 25 or 75. It's a really big challenge anytime it comes. For young adults that we serve at Young Adult Cancer Canada, it's different because of the life stage. So those milestones that I just touched on a minute ago are super important and often sometimes really challenging to hit on their own. You can imagine they are extra challenging at times when you throw a cancer diagnosis, treatment, and considerable recovery for many on top of that. And my own personal story is certainly no different. At tops of trees, I can tell you this is me in the morning of my first bone marrow transplant from my dad, who's in the wheelchair, dropping the puck for me. Had a face off right before I went in to have my bone marrow transplant. For me, recovery from cancer, and when I say recovery, I really mean holistic recovery, physically, mentally, emotionally, socially, professionally, financially, spiritually. It was a long road. Um, Physically is, I think, one that people see, and it's often very visual for people, right? You lose the weight, you lose hair, and then hopefully you gain back some weight, your hair regrows. They can see you looking more healthy, hopefully, if you're lucky. The mental, emotional stuff is often much harder to see. It's often within and inside us, and those struggles can extend for a long time. And I have a little bit of a few stats on that in a minute. Socially is very similar, I would say. I often tell people, for me, um, I realized when I was diagnosed with cancer that there was two things that drove a huge amount of my social life, and that was beer and hockey. And when I could no longer drink beer like I used to, or didn't want to even, or play hockey like I used to, a huge amount of my social connections with my peers disappeared. And I can say that was one of the longest pieces of reconnection and recovery for me, was on the social side, to find my way back, for a while, probably trying to find my way back to my old life, and then eventually realizing that it was actually a new path that I was searching for. And it took quite a while to find that. Professionally and financially, again, is a real unique struggle for young adults. Most of us are not at the top of our organizations or our companies, or perhaps even finished university, depending on the phase. We're not financially robust. Perhaps we're not even financially independent at all. Cancer can create some massive obstacles for us on that front as well. And spiritually, for me, I will say, I used cancer as a real opportunity to dig into my worldview and my role in this place, and it was a massive time of growth for me, spiritually, but still challenging. Again, trying to reconcile who I was, and I'm still very similar. Was still the same guy. How I found the way forward in that path. All of those things combined, there's a lot going on there in that space, and it's certainly Yak's work to help young adults holistically recover. That's what we're really interested in, not just remission, which is a beautiful milestone. That's how I like to think of it. It's a beautiful milestone on the road to recovery if you're lucky enough to hit it, but it's certainly not the end. It's really just one little hit you want to make along the way. If we think about why Young Adult Cancer Canada is here, and really the big two things that drive our work, it's because cancer is different for young adults, and because almost always recovery takes longer than treatment. And those things really drive our mission forward. Some stats from our very first major research study, called the Yak Prime study. One was that 50% of young adults are off work or school 1 to 3+ years. So you think about how much time that is away from your pursuit of school or career building. For me, and certainly for my dad, because I asked him, his primary goal in raising me was to have me be an independent person. And then when immediately as I grabbed that, I was diagnosed with cancer and forced to shut my business down and move back home within a month of diagnosis, giving up that independence that I had just started to grasp. So this extended break from school and work can provide opportunities for sure, but it creates a lot of struggle and challenge, especially on the financial side. I won't get too complex with this, but I want you to take away that what you're seeing here, I'll explain in a second. What you're seeing here is this underscoring of recovery just taking a lot longer than treatment. In this PRIME study that we did, we asked the same instruments sometimes that stats can use. So we were able to get a comparison group. You'll see on the right are young adults without cancer in Canada that matched our group, the survivors on the left, by age and sex. And you will see self-reported physical health on the left and mental health on the right. And you'll see the yellow bars really representing the poor health. And you'll see a big gap on the left on the physical health, the self-reported quality of life, and you see an absolutely striking gap on the mental health. And this is comparison, if you want to think about it this way, of the young adults in our study who are dealing with cancer and recovering from cancer, and then their peers, if you will, friends even, who did not have a cancer diagnosis, and how different their physical and mental health is. What you should also know about this part, this is a cohort of the ACT Prime data of young adults who were 6+ years post treatment. So many of the adults that we'll connect with feel like they should be back to normal and they should be back pushing the ball up the hill sooner. The reality is it can take quite a long time for many of us. You should also know that Yak's work is all about connection and community. And our Prime study found that those who feel connected to the auto cancer community, they have less distress, they have better mental health. We also found that those who don't feel connected have what we'd call bad coping or maladaptive coping, and they have less of the good coping, the adaptive coping mechanisms. So this idea of connecting to peers that are like you uh, can have a real profound impact on your life. And it doesn't have to be Yak that where you get that, but I would encourage you to find people who are your peers who you can connect with. It can make such a massive difference. When we think about Yak's work, we're here to support young adults with, through, and beyond cancer. Those words are really intentionally chosen. There's a cohort of our community who will live with their cancer for the rest of their life, and we want them to know that they can come to Yak and they'll find a place here. And our goal, of course, is to get as many as we can through and beyond that cancer experience. So cancer's on your resume. It's not, we're not taking it off anybody's resume of life, but we hope that we can put it in a place where it can be a place that you can build from, not a place that's really, really, really knocked you back and you can't recover from. Our connections are all about web, local, and national connections. I'll highlight just a couple. And the mantra that we bring to our work every day is every cancer, every stage, Yak's got your back, right? So every type of cancer can come to Yak. In the cancer system, the adult system, you're organized by what part of you has cancer, and that's important for treatment, of course. But I'd suggest to you that where you are in your life matters way more for everything else than where cancer is in your body. Every stage I just mentioned, with stage 4 cancer, stage 3, 2, 1, whatever stage of your diagnosis, your prognosis doesn't matter. And also, every stage, we mean you could be diagnosed today and you feel like you need some support and you're aware of that and you're dialed into that from the beginning. You could be 10, 15, 20 years out. If you were diagnosed under 40, are currently between 18 and 39, then Yak's got your back. And we say Yak's got your back, and we mean you in our community, which I'll show you in a second. You get to decide how much or how little you access that community, how much or little you use our programs. But we think you're in our community and you're part of our team as long as you need us. And a lot of young adults, we Yackers, we refer to them as affectionately, of course, they will fade in and out over time. Any number of things can happen. They feel great, that they're ready to move to the next space. They have a scare, or they have a buddy that has a scare. It could be anything that encourages or sparks them to fade in and out. And we're just here. We're that silent, amazing support community that is here if you need us at any time. When I talk about face-to-face programs, on the left side is Survivor Conference next week. We're going back to our face-to-face Survivor Conference, first time in 5 years in Toronto. It's super exciting. And Retreat Yourself Adventure is one of them, several retreats that we usually offer, and we're back to those now as well. This is on the west coast of Newfoundland. We hike a mountain together, and this is at the top of the mountain, Grossmore Mountain on the west coast. These are powerful experiences for young adults to come. They come together from across the country, and it's really incredible to be together with people who have two really painful but powerful things in common, right? Just being young and having had a cancer diagnosis. And magic happens when you put those kind of people together. And that's what we do. We also offer a collection of web-based programming. Web-based programming was actually the first national programming we offered 20 years ago, believe it or not. Our website is full of stories and articles written by survivors talking about all kinds of issues that they've dealt with. You can think about dating after cancer, talking to your kids, time away from school, redirecting your life. Like Anything you can think about, we almost certainly have content about it on our site. We have private social media groups that are constant sources of discussion, questions from the community, answers and response from the community. We run a chats program 3 to 4 a week, 90 minutes on Zoom, facilitated by a survivor trained by YAC. Great ways for you to connect with your peers anywhere you live, right? So sometimes those face to face events are not always accessible. The virtual spaces are incredible options when that's not available to you. We talk about community. This is what we're talking about. This is the Yak community. It's a little bit small there. Hopefully you can see it. You'll get the flavor. This is the Yak community by community and postal code. So we literally have young adults in every province and territory, and we're 6,000 and growing now. This community of young adults. So when you access a chat or join Yak and come to conference, you will get the opportunity to meet other young adults immediately. But I would like you to think about what you're actually doing is joining in a community of young adults, coast to coast to coast, that are there. They're dealing with the same things you are, or they have already dealt with them. And we're giving you an opportunity and encouraging you to tap into the wisdom of the lived experience, because that can be an incredibly powerful thing in helping somebody's own recovery. And that's what we want to do. The last piece I want to share is just quickly is we're in the process now of recruitment for our second huge research study, and beautifully, it's called Recover. We're building a 2,000 person cohort of young adults across the country, at all stages. You just have to be diagnosed under 40 and over 18. You could be 65. It doesn't matter how long you've been out. And we're trying to build a picture of what does cancer recovery look like for young adults. What's the triumphs? What are the challenges they're facing? And we're going to actually follow this group over time so we can get a better picture and more color and detail, if you will, if you think about stats and data being color and detail as we go, so we can better understand and thus better serve this population. There's a real gap in this area right now, and we're looking forward to filling in some color in. The Recover study can be found on the Young Adult Cancer Canada website, or easy to find. Just search for us. I am going to stop sharing and thank Mackenzie and everybody for the chance to connect with you all. And I am not sure who I'm passing it to, but I know Mackenzie knows who I'm passing it to. So I'm glad to slide it over. And there's the name
It's
there.
me, Geoff. It's me you're
Love it.
passing it to.
Love it.
Hey, Geoff.
I'm so glad to pass it
Good
to
to
you.
share
High
the
five,
stage
my
with you
man.
for a second there. Yeah, virtual high
Great to
five.
see you.
Yeah, you too. This guy, before he's just leaving the stage now, but Geoff has been so instrumental for the young adult cancer community in Canada ever since he founded YAC. And he just walked you through it himself, but there's so many different programs that YAC offers. So many different ways of connecting, whatever your style of connecting with peers is. Whether you want to do everything that he mentioned or you just want to pick and choose one or two things that Yak offers, I really, really encourage you to do that and check it out. And we're going to talk a little bit more about resources right now. In case you don't remember from Mackenzie's introduction at the start of the presentation, I'm the Adolescent and Young Adult Psychosocial Clinician. That's my official job title, but I'm a social worker by background, and I provide counseling and therapy to teens and young adults here at CancerCare Manitoba, and I am so happy to be here as part of this presentation today. We are also going to pop up some slides. They're actually being controlled by Mackenzie, so she's going to pop them up. Look at that. Look at this coordination. So she's going to go ahead to the slides that I want to talk about. So I just want to do an overview of our program a little bit. We have a multidisciplinary team at CancerCare Manitoba. We're so fortunate to have the support of the CancerCare Manitoba Foundation in order to make that possible, which in turn, of course, is only made possible by the donors who donate to the foundation. So in addition to Mackenzie, who's our clinical nurse specialist, and myself, who's the psychosocial clinician, we've got our family photo here. So we've got behind me is the program coordinator, Madison Showman. She is often pulling all the strings and making everything happen behind the scenes, very instrumental in the programming that we're able to offer to our AYA population in this province. And then we have Cindy Marie Mack, who is our occupational therapist. And we are very pleased because she is the very first occupational therapist to ever work at CancerCare Manitoba. And she's dedicated resource for the AYA population here. So we're very lucky to have her on board too. And then behind Mackenzie, we have Caitlin Woodrow, who's our dietitian with the AYA program. So we have this multidisciplinary team. Sometimes you might have touch points with every single person you see on the screen as part of that team. Or you might just see one or two of us, but we're here to provide that kind of wraparound support to try to make that care experience better and easier, although it's always very difficult throughout treatment, but now, as we're talking about today in this presentation, in recovery beyond treatment as well too, because as the title of our presentation states, recovery does take longer than treatment quite often. And I do want to just pause on that thought for a minute, because I think sometimes when people reach the stage of after their treatment is over, I also want to note that not everybody has sort of a post-treatment phase. Some people are on treatment for the remainder of their lives. A lot of times when people get to that point, they feel that, oh, it's going to be perhaps like I finally reached the goalpost. I'm done my last radiation. I'm done my last chemotherapy. And they have this date in their mind that, okay, that's when life is going to go back to normal, right? And then sometimes they reach that point. Quite often they'll reach that point and realize, whoa, this is not at all what I expected. You know, sometimes they're being surrounded by friends and family who are wanting to, you know, throw them a party and have a cake and say, hey, well, you made it, right? But in so many respects, it's just a mile marker. It's not a finish line. And life does not just go back to normal, right? And sometimes we can tell people that while they're still in treatment, and we're trying to convey that message too today. But often it isn't until you're in that moment of post-treatment life that you realize, oh, there's all these different ways that my life has changed, and I feel like a changed person now. And how do I sort of make sense of what happened? Because sometimes when you're in treatment, you're really just focused on how you're feeling physically, maybe, and when is your next blood work, and when do you have to be at the clinic to get chemotherapy, and you can kind of get in this loop. And then sometimes once treatment ends, it's like, okay, now I've got to kind of build back and figure things out, and it can feel very overwhelming. So that's another reason why our multidisciplinary program exists now, is because there's been increasing recognition across the country and across the world. And a big hat tip again to Young Adult Cancer Canada for elevating this concern in the cancer community in our country, that we need to provide better support to teens and young adults who are in that stage of their life that Geoff was describing, where they really need that additional support because of all the changes that are different for them compared to their peers who haven't had a cancer diagnosis. So in our program, we also provide peer connecting opportunities. There's a monthly support group that I facilitate that I'd be happy to share about if people want to reach out individually. We also have meetup events now that we're able to just have go for a social outing somewhere in the city, and people can bring along someone who's a support person for them as well too. And then that's just another more informal, fun way of getting to know other people. And there's something about people who get it, you know, similar to what Geoff was saying, is that you don't always have to explain, oh, what it's like to have cancer. Because sometimes even if you have friends and family in your life, sometimes don't really know how to carry on a conversation that's cancer related. So to be able to connect with other peers in the cancer community here at CancerCare Manitoba can be super beneficial for people's experiences. So you can see on the screen there, if you just go back for a sec, Mackenzie, there's a QR code that if you want to scan that, you can. It'll take you to a login, or sorry, a sign up page. And you can just put in a couple of pieces of contact info, and then someone from our program will reach out to be in touch with you and figure out what kind of services you want to access that are going to make the most sense for you. So you can pop the slide ahead there, Kenzie. So I just want to pause briefly on this slide. We're going to talk about resources, but I want to point out that one in the foreground there, the AYA Program Resource Navigator, is available for you to check out. If you check out the resources tab on the right side of your screen, it looks like a dog-eared piece of paper. If you click on there, you'll find a link to that AYA Program Resource Navigator. And we try to provide as comprehensive a list of resources that we could, both local, national, and international. So we encourage you to check that out today. And there's also information in the virtual booths here as part of the patient and family conference. And let's get to the next slide there, Mackenzie. Okay, so we've talked about YAC, and Geoff gave you a rundown of all the different programs that Young Adult Cancer Canada offers. There are other ways of getting connected with peers too. There's Pink Pearl, which is one that provides women who have any type of cancer to connect with each other and go on retreats and have online opportunities as well too. There's AYA CAN, which is a national advocacy organization that has deep roots here in Manitoba. Cancer Dudes is one focused on men who have cancer and looking to connect with other men. There's Cactus Cancer, which is an American-based one that has so many different types of creative online programs. Definitely worth checking out their website. And Wellspring Cancer Support provides support for people of all ages with cancer, and they have some specifically dedicated towards young adults. So it's worth checking that one out too. Yeah, so I wanted to just pause on that screen. You can sort of jot those down, but if you're not sure what any of them are, again, you could check out our resource navigator that I mentioned a moment ago. And of course, you can reach out to us, and we'll certainly help you connect to whatever resources that you feel like might be beneficial to you. Okay, so I want to now, again, take a moment to introduce our next speaker. So Mackenzie mentioned this at the beginning, and I'll say again, we're very lucky to have Dani Roulette here today. She's a patient partner with our AYA program, and she has lived experience with cancer, and she's going to take the stage now and share a bit of her story. So thank you so much for joining us, Dani.
Miigwech for having me, and thank you for the introduction, Ian. I'm really grateful to be here and just to share a bit of my story with you all today. Anin zungaze nebue neme wabishke benisi kwen indishnakaz makonan dudem. Hello, my English name is Dani, and I'm Bear Clan from Dog Creek First Nation. And in the summer of 2023, I was diagnosed with triple-negative breast cancer. Prior to my diagnosis, I was a full-time caregiver for my brother who has autism and cerebral palsy. I had just moved to Winnipeg after being hired in a communications position at an Anishinaabe organization. And at the time, I just felt really lucky because this job felt perfect for me. I was attending ceremony regularly, traveling between 5 different reservations for work, and I was trying to figure out my life, but overall I felt healthy and I felt really ready to just focus on pursuing my dreams. And honestly, at the time, cancer was the furthest thing from my mind. It wasn't even a slight worry for me at that time. So everything happened really quickly after I found a lump in my breast. Thankfully, my family doctor took me seriously and decided to schedule an ultrasound and a mammogram. This is something that I'm just so grateful for because a lot of young adults are unfortunately dismissed by their doctors when they have concerns. And I was 30 years old with no family history of breast cancer. And my doctor said that they were most likely cysts. And I say they because between finding the initial lump and having my physical exam, another lump had appeared in my left armpit. I knew something wasn't right pretty much immediately after the ultrasound, and I remember driving straight to my auntie's, and she prepared a smudge bowl for me with a natural medicine that we inhale for anxiety. And I've always found healing, and I've always sought comfort through my culture. I've grown up with Ojibwe teachings all of my life, and they really just inform all of my decisions and make me who I am. And maybe it was naive, but I didn't think that this was going to be something I'd have to explain so often during treatment. But the truth is, it's largely unknown to the outside world just how much our teachings mean to Anishinaabe. And at the time, it was unknown to me how much sharing and explaining I'd have to do in terms of what it means to be a Ojibwe and a cancer patient in Canada. I was always thinking, would I find understanding? Would that part of me not only be accepted, but cared for? And because cancer had been the furthest thing in my mind, I felt completely blindsided. Looking back after my diagnosis, I alternated between shock and panic. I had to freeze my eggs, make arrangements with work, go to all these different scans, all the while I was feeling incredibly overwhelmed and scared. And during my very first appointment with my oncologist, I remember that he told me that my hair was very likely going to fall out after I started chemo. And all of my life, I was taught that my hair holds my spirit as an Ojibwe person. And I made the difficult decision to cut my long hair up to my shoulders prior to starting treatment. And I remember afterwards, I was at a full moon ceremony with my family, and I was holding my two braids in my hand, and I was just stroking them over and over again before I offered them into a sacred fire. And it just felt like I was throwing a piece of me into the flames, and I just wasn't sure if that was ever going to come back or if I was ever going to be the same after all of this. Um, so my moon time menstruation connects me to Nokomis, which means grandmother in Ojibwe. It's grandmother moon. And it stopped after I was injected with Lupron to induce medical menopause so that the chemo hopefully wouldn't attack all of my eggs. I was taught that my moon time was when I was closest to Creator. It's when I'm at my most powerful, and it was a time of deep healing. And all I could think was, what was it going to be like if the Lupron didn't work and I never got my moon time again? So when it came to losing my hair and my cycle stopping, I was met with a lot of "it'll grow back," or "you look so good bald," or "it'll probably start again." And I had to share that for myself. It was a really intense struggle. I felt like I was losing very important parts of who I am that I'd always honored as an Ojibwe woman, and I wasn't sure if they were going to come back. So many of our teachings are linked to our hair and our moon time, and I would just think, how could I even begin explaining this to people? And in a lot of ways, I still don't know how to fully do so. And on the other side, some of my family and ceremony leaders didn't think that I should receive treatment. They didn't think that I should have surgery or do chemo or undergo radiation. And I was told that this is the time when I'd find out how strong my faith really was because our traditional medicines and ceremony were so strong. I was told that that is where I would find my healing. And I did. I did find healing in ceremony. It saved my life so many times, but I had a big decision to make, and I knew that in making it, I would be disappointing some of my elders. But the pathology report showed that the tumor was highly invasive and I needed to begin treatment as soon as possible. So I did agree to the treatment plan that my oncologist presented, and that's when I began walking in two worlds. I also attended a lot of ceremony while I was in treatment. I sat with my elders, I went to feasts, I offered spirit plates and tobacco ties. I also did everything that my doctors told me to, and I completely trusted the treatment plan. I tried to take full advantage of CancerCare supports. So I began seeing a counselor. I attended online support groups and writing groups through YAC, all of which had such a positive impact and just really helped me process what I was going through in a deeper way than if I was trying to do it all on my own. Um, there were definitely aspects of both of those methods of healing that sometimes didn't understand the other, and it was up to me to navigate those aspects. I can say that in cancer spaces, I was always met with kindness when sharing that I was Ojibwe and what that means to me and how it impacted how I felt while I was receiving treatment. And I made such deep connections in online YAC support groups that I decided to attend an AYA in-person support group once I was feeling better physically. I also applied to an excursion in Quebec through the Tip of the Toes Foundation, which I found out about through the AYA newsletter. And this led me to going on a multi-day canoe trip along the Poisson Blanc Reservoir with other cancer patients who have just become really good friends of mine and I'm still in touch with. Um, the comfort and strength I found in these spaces is almost indescribable. Once my treatment was completed and I was told I was cancer-free, I was happy, of course, but parts of me are different now. Cancer had a physical, mental, and emotional toll that I'm still navigating and trying to make sense of. But counseling and support groups help me so much. They make me feel less alone, less polarized. I find similarities in other journeys because we often face a lot of the same difficulties, even if we are diagnosed with very different types of cancer. Often people in our lives can expect us to just be immediately back to our old selves once we're done with treatment. And initially, I think I even believed that too. I thought that I'd finish treatment and I'd move on and it would be over. But I'm coming to understand it's never really over. There's always going to be mammograms and scans and appointments, and that'll never stop. And a lot of people won't understand that I'm different in many ways now, but the cancer community understands. And I've learned that it is possible to walk in those two worlds and find different methods of healing in both. There are aspects of my identity as an Ojibwe woman that I'll have to explain in ways I wouldn't have to with other Indigenous people, but now there are also aspects of my identity as a cancer survivor that some Indigenous people won't understand. But I have hope that in the future that's going to be different. In English, my spirit name translates to strong, standing, dancing, white thunderbird woman. My elders taught me that I need to say my name in Ojibwe because in English it holds no power, no meaning. And maybe it doesn't. But I believe there's power in sharing my name with others, even if it's in English, because I know what the real words mean. I know the power that it gives me, and I'm grateful to be listened to when I share who I am, to have the opportunity to say my name out loud in Ojibwe when I'm introducing myself, because no matter how difficult things became, that power never left me. Miigwech.
Awesome. Can you
Wow,
hear me, Dani?
Dani, that was incredible. I'm trying to hold back tears. So everyone that knows me knows that I'm the emotional one here. But your story is powerful, and we are so honored that you've joined us today to share about your experience. So thank you for taking the time and sharing with us. It's been amazing. Um, so we're just going to as we're going to now move on to just a period where we're going to chat a little bit about what it means to kind of recover and move on from that active treatment phase, and what it means for a young person to be in that area and that space. We're going to have kind of a panel discussion between the four of us. But as we're doing that, I would like to encourage our participants to feel free to put some questions in the chat that we can kind of layer within. And hopefully, this can just provide another meaningful way of us just exploring the experiences of a young person that is recovering, and what nuances kind of unfold during that time. So, I'm gonna hand it over to Geoff. If you want to start us off with some questions, that would be
Uh,
excellent.
that's awesome. Thanks, Mackenzie. And Dani, thanks. That was so great. So many
Miigwech.
things that you shared really resonated with me. Your connection to your grandma, like that was I thought of both my grandfathers so regularly during my treatment, and um, you are very fortunate to have had a doc that took you seriously. There's no question. Like you mentioned, I'm sure, and have met many young adults who have struggled to get the attention, and that's, I think, the system is at some significant level behind the eight ball on that one, because most young adults don't get cancer. Most of the time, it is something else, except of course when it's not. Um, and I think you touched on so many great things about the recovery side, and I know you're really kind of actively exploring that. That's how I would say it. I'm quite a long way out. It is still with you, with me. I think, like you said, it's wise words. It'll be with us. It's part of our resume of life, I think. I would say for me, the first time I had a couple of bone marrow transplants. The first time, my doc kind of said, your energy will come back in a year or so. So I had that kind of expectation of self. Some like a simple short sentence, I think, could have such weight. At least it did with me at that time. So I kind of had that expectation of myself, and it took a lot longer than that for a collection of reasons. But I wonder if you could poke around that space of moving to another phase of your experience and having expectations either set by you or maybe your health professionals, and how you navigated that. Something come to mind for you there?
Yeah, so I definitely nothing was ever said to me in terms of how long it would take until I began feeling maybe more back to normal, but I definitely thought by the time I came back to work, which was just the end of October, that I would be at least a little bit close to my old self. But I'm finding I'm having to take naps during lunch and kind of having to do things I never would have had to do before, and I've had to try to not be so hard on myself when I think, well, I can't exactly do everything I used to with such fervor. I can definitely see a difference in myself at 30 when I was first diagnosed to now I just turned 32. And I'm just trying to focus on how I am now and what I can do now and how things might have to be a little different for a while, and just kind of navigating and seeing if I will be closer to who I was before, if there's just like a
Mm,
new normal I have to live with.
yeah. Dani, I
Yeah,
love that you shared about, two worlds, um, and what that means to you. Um, and do you feel like within the community of your family and friends, like, um, is that always, I mean, you shared that sometimes it's not an easy experience where it doesn't match where you're at, but do you feel like overall you have that support to kind of navigate that as you go?
I would say yes and no.
Mhm.
Um, a lot of my family are very old school, I would say, where it's like you go to a sweat and everything's just it's going to be fine, or it should be fine if you believe it enough. And I'm sort of having to, I guess, decolonize my own thinking in terms of that and realize that I can approach ceremony in a way that doesn't guilt me. There are times when some of my family members who are from a different generation will say, oh, you're just overthinking it, or maybe if you don't focus on that so much that you'll heal quickly. And it's just something I'm having to navigate as a 32-year-old woman, where it's like, no, I don't have to take on those perceptions and those beliefs. I can heal through my culture in my own way and let it heal me how I think it needs to. So I do have that support, but then there are some things that I have to work through on my own. But
Mhm. Mhm. We have a question in our chat that speaks to some of that disconnection between family and friends, and but also an interesting take on whether or not, if there's any disconnection that happens between other cancer patients, so our peers that we are with, or survivors when you're with an AYA. So um, I don't know if that makes sense, but I perceive it kind of as, is there kind of a disconnection between how one goes through their survivor experience between another individual that might be, experiencing a different pathway, but yet still kind of in that recovery phase?
Mhm. I think for me personally, there was the obvious disconnection from friends and family who um, weren't experiencing cancer and never have. But then, in terms of other cancer patients or survivors, because I connected with so many other cancer patients through YAC and at the Tip of the Toes Foundation excursion I went on, I guess the feeling of disconnection for me would be when there was really opposite ways of handling things, and you could tell that
Mm,
we were kind of dealing with things in different ways. So there was a sense of disconnection, but then I just would tell myself it's important to hold space for them and that our journeys are different, even if there are these similarities.
yeah,
So there was definite disconnection, but it's just something
yeah,
that I kind
yeah.
of would go through.
And I think Ian and I could probably speak to that too, where everybody has a different way of how they process their experience and the pieces that they go through. Some may experience more physical changes to their body, whereas another might not. And so there's a lot of nuances with the different areas that are especially concerning. Um, to that individual, as opposed to another, and then also resilience and just that supportive kind of platform. Some people are navigating this on their own, and it can be very isolating for them, which is why we're here as a program. But still, it's a very kind of personal piece that they go through. I don't know if you guys want to add anything else to that.
Yeah. Yeah. Another way I interpret that question is the disconnection from other patients and survivors. So if Dani's an AYA, a young adult, like sometimes there can be this sense of like coming to the cancer center and going to the treatment room and you are, 3 decades younger than everybody else there. And that is a real source of disconnect that we hear a
Mhm.
lot from AYAs, that we would love to be able to create more spaces, and we're working our hardest to do so. But there is still a sense of looking around and feeling a little bit in the spotlight because you're clearly the youngest person in the treatment room. And that's something that we're continually trying to be conscious of because it's
Mhm.
often a source of stress and a bit of alienation too.
And actually, that's a good question. Sorry, Jeff, I see that maybe you were trying to speak. I'll hold kind of
Okay.
some space. Go ahead.
I would say many Yacker has expressed the challenge and frustration at times of the experience of reaching out to the local cancer support group and doing exactly what Ian just said. You go to that place and you find that you're 3 decades under the average. So when you're looking for support, and oftentimes it's like, finally, I'll go get some support, and you end up actually getting the opposite of support. You're just reinforced how unique and different and alien like you are in this experience of young adult cancer. So often they'll retreat even further back into their own isolation because they tried that thing and it was not at all what they're looking for. Um, on the friends and family side, I obviously it's cancer is such a customized experience, right? That's one of the first things I say. It's like you can have the same age, same diagnosis, same treatment, but have like such very totally different experiences. And friends and family are the same. A lot of people that we've connected with will say cancer is often a really great or terrible filter for your friends. So many cancer patients in the Yaks community will talk about having people they thought were really going to be there for them disappear. And if they're lucky, oftentimes there are people who they never expected to step up, become really powerful and incredible friends. And that's like life challenges, right? It really, I think, puts a different kind of light on your relationships all around friends, family, other survivors, coworkers, everybody. And that can be a blessing and a curse. There's no question. It's got pros and cons on that side. And I think that's probably not unique to us. It's likely happening at every age, but I do think it is different for us because I do feel our peers are just so important at our
Mhm.
stage of life that those 20s and 30 years are so they're just so important. So when you have a betrayal, for example, which so many of us have, I do think it cuts it's a bit deeper.
Mhm.
It's interesting you bring that up. I often share this with folks, but I often forget to share it too. That I too am a AYA survivor, and I was 17. So when you talk about peers and like the disappointing part, it just brought me back to that classic high school um, betrayals that happened and I do very much remember that impacting how I then trusted friends going forward, and who my unexpected people were. And the best friend in my life was the one lying about being the best friend and didn't actually show up. And then my two like out of the norm guy friends were the ones that consistently cared for me and still do years later. So you're very right. It does disrupt so many aspects, but peers I think is the biggest. Like one of the most challenging parts to navigate is feeling like you belong, but also like you don't belong. And we talked there is one question that talks about the impacts of cancer, and whether or not this is harder on children, I would say on AYAs, due to their developing immune systems. But I actually want to kind of explore that in greater detail to say that maybe not its immune systems, but it is the fact that over this span of ages 15 to 39, the impact of cancer does touch on so many different aspects of our lives as we grow up. And and where it hits during that time is, yeah, I mean, it's very dependent on where we're at in that developmental stage of our life. But I'm wondering if somebody could speak to that. I mean, Dani, you spoke about how it was like, or what it was like to be in your 30s. Um, I was 17, so that's a very different age span. And um, I think for myself, it definitely changed a lot of how I went about my high school career and also post secondary, and also kind of that emerging independence. But maybe we can open up the discussion to some of those things that we're seeing, the impacts of this age group within the cancer continuum and how it impacts that.
You want to go ahead, Dani?
Yeah, sure. So I guess prior to my diagnosis, I was just trying to figure out my life. I was 30. There were so many things that were changing that I was trying to sort out. And then after I was declared cancer free, I think I'm still in the same place, but I have a new lens on things where I've been kind of prioritizing myself more, connecting with people more, traveling more. Um, I'm having to like rigorously not compare myself to my friends who are also in their 30s because they're having children and getting married. And I mean, my eggs are frozen, which I'm so grateful for, and things like that. But so many things in my life changed after I survived cancer, and it kind of shook up my life in a way where I'm not really following the same kind of course that a lot of my friends are, the course that I thought I would be following. So it's just kind of trying to navigate where I am right now and just do with it what I can.
Whoops, I lost. I can you still hear me? Okay, gang. I'm losing battery here. I have so many thoughts on this. I would say, from my perspective, one of the biggest challenges I had was giving up my independence and dealing with the big, huge bureaucracy of the cancer system. And a lot of my health professionals really battled me on that. They didn't like that I was challenging or asking questions or pushing back. And do I need that test? I just had this one. Can we have why don't I have a mobile chest x-ray in my room instead of you throwing me down in the hallway and I'll wait for an hour in the freezing cold? Like it's so every little detail. Many were amazing. Many really struggled. I can see hindsight, definitely a huge part of that was me just trying to get a little bit of control in a situation that really took over my whole life. Like I had lost so much control over my life. I could see how different my worldview was with going through that system that was obviously also not made for me. It was made for my parents and grandparents. So I could see the balance, the battles and the struggles in that space. And there's so many layers, Dani, just to circle back to it, because you just touched on it a while ago now, but in the recovery space, the rehab counselors I know often refer to the above the line or below the line. And I know often when we're in recovery, and our energy and our stamina, if you will, emotionally, mentally, physically, when we get to that place where we get above the line and we start to feel like a little bit more like ourselves again, often, especially for young adults, often will take the next step, whether that's going back to work or something that pushes us to the next level. And that can be a really precarious and dangerous and unique place for young adults as well. Like there's financial reasons why we'd push that, right? There's practical reasons. We've lost so much time. We need to catch up. There's so many factors that influence a decision of how we move forward the next step. And then at the same time, it can be really challenging. It's super common for us to take that step and then drop back down below the line.
Mm.
And how you manage and navigate going up and down that line in our recovery is also one of the kind of nuanced, unique elements of recovery that we don't really hear much about. It's hardly talked about. I think in the yak world, it would be talked about a lot, but it's not something that I had a lot of discussion about, or I've heard anyone say they've had much discussion about.
I want to jump in with one of the questions that's at the top of the thread about whether friends can attend with other AYAs to the different support programs. So, like I mentioned when I was speaking, that our meetup events, we started to allow for a +1. So you can bring along a supporter, whether that be a friend or a colleague or a sibling. You just can't bring your parent or your kid. So our support group, though, is just for patients. A big part of that is that if we have support people in that group, it does dramatically change the dynamic in a support group and where people are sharing information about themselves, um, especially if not everyone brings a support person with them, which some people cannot. But we are really trying to make our social events something that people can bring someone with them. And Geoff, if you want to speak to that too, I know supporters and caregivers are a huge part of the ACT community as well too.
Yeah, we take very similar, Ian. You can be a parent, but you can't bring your parent to YAC. You can bring a supporter to all kinds of events, social, local life in Winnipeg. We run in the 4 days. We will often have a supporter or caregiver specific sessions at conference, for example, and we have a caregiver specific private support group. Like there's other things that we have because there's no question. I think the diagnosis hits me directly as the patient, and it of course sends this huge tidal wave all around me, and caregivers, those connected to the patients are deeply impacted by that diagnosis and the treatment, and of course the recovery, all of the things that we're talking about in this extended road. Man, the caregivers in many ways have it just as hard, or sometimes I would say even more difficult, depending on the situation and what they're trying to manage. And right, depending on if there's family they're trying to keep up, or work and keep the family, the house together, all kinds of pressures. So we would welcome them and encourage them to reach out, because the same thing, this idea of peer connection, connecting with other caregivers, can make a huge difference for those
Mhm.
that are in this situation.
Thank you. We do have some more questions in the chat, which thank you all for your feedback and questions. Um, there is one that I think is really important to talk about, because often the case is that when you have your cancer treatment, your ongoing surveillance, it's only for a matter of time, and then you are transitioned back into your community. So one of the questions was, what does someone need to know about getting regular follow-up care or screenings after treatment and throughout their survivorship? And I think it's really important to hold space there, because um, there's a lot of nuances with that, especially if you are a younger individual who's been under the care of your pediatric doctor, or you're under the care of your parents doctor and things have shifted and you might not have your own primary care. And what does that look like? So I can speak to it from my role as somebody who kind of helps folks navigate within that transition period. And one of it is that obtaining a primary care provider even during your cancer treatments is also really important, that you start building that foundational understanding of who you are and that trust. Regular follow-up care and screenings are also very important, and CancerCare Manitoba does a really good job in helping folks transition outside of the cancer center into the community by providing some transitional packages that guide you into what the recommended screenings based on your diagnosis and what your treatment experience has looked like. So in some cases you will get a very clear understanding of, for example, Dani, for breast cancer, the sequence of mammograms and exams that you need to consider. Sometimes heart function tests are necessary due to some of the chemotherapy agents. And so these are really great packages that you can obtain from your oncologist. Um, our role within the program is to help guide you in that, to help you advocate for yourself. But I also think that another really important part is really addressing the concept of fear of recurrence. So this is something that happens, I think, for many cancer patients within our AYA program age and extending beyond. The worry that cancer will come back, or the worry of a secondary cancer, is a very real thing. And I want to open it up, and I'm hoping that maybe Ian can even speak on this too, about what that is like for many. I have my own personal experience of what that's like for me, but I think from a provider's, if you can share about, what that would look like, that would be great.
Absolutely, yeah. And I think we're going to push past our scheduled 1:20 time by a few minutes because the next presentation is not quite ready to get started. So stick with us on this channel. This is where the action is right now. So fear of recurrence is so common, as Mackenzie just alluded to, that it is almost, there's an anticipatory fear of recurrence. Even if you're still in treatment, you might be having fear of recurrence, even if you're not sure if the initial treatment has fully worked yet, because of that powerful sense of, if I'm going to be done cancer and I'm going to go through all of these things that we've spoken about today, if we're done treatment and I'm going to try to rebuild back my life, I don't want to have the other shoe drop on me by having cancer come back suddenly. So there can sort of sometimes be an emotional hesitancy of trying to do those things and move past beyond living like scan to scan or just waiting another 3 months for your next scan, right? And so it's a very difficult thing to try to process. And it is a form of anxiety, right? So some of the things that we know that help with feeling anxious can also help in the category of fear of recurrence. So whatever you currently do to help cope with your own anxiety, you can try that out on fear of recurrence, and some of that can help. And I also like to remind AYAs that I speak to is just ask them. It seems like an obvious question, but why did you consent to treatment in the first place? And most of them will say, well, because I wanted to live, I wanted to survive, I wanted to have a life to live after cancer. And then it leads to secondary point of living like you're going to be alive, right? And that can sometimes help address that real fundamental fear of recurrence that can creep up on people.
Yeah. Super great points, Anne.
Yeah, thank you. So we do have the ability now. We're going to wrap up. I want to thank you all for joining us, and special thanks to Geoff Eaton and to Dani Roulette. It was phenomenal to have you here and share about these experiences. Thanks again, and take care, everyone.